Good morning, everybody, and thank you for coming to today's Restaurant News Networking Group, 9 o'clock. Today is October the 13th, and we are a group of restaurant vendors who are here to help each other grow our businesses and to help any restaurant owner, manager, or chef with a problem they may have. We are able to help you. And even if we can't, we know somebody who can. So if you'd like to join us, give us a call at 561-620-8888. Or go to our website at trnusa.com and give us a look on YouTube at Today's Restaurant. We've got over 300 videos stretching going back about 5 years. And you can watch how we age.
You recorded that?
Yeah, gotta have a little fun.
Howard, that was when Howard didn't have gray hair, right?
I ran into someone yesterday that knew him when she was a child and recognized him and said, "You haven't changed one bit."
She used to babysit for my son.
Wow.
Mm-hmm.
Who is now 41. Yeah.
So,
I didn't know Martha Stewart knew you.
how about we do our intros real quick, and then we'll turn it over to Rick Israel, who's going to give us a presentation today. So, Ed, get off the phone and start us.
Business comes first, you know.
Yeah.
Certainly does.
You get a phone call from Tallahassee, who know we're an 850 area code from someplace out in the Panhandle.
It's the governor.
And
They want to sell you a car warranty. Don't worry about it.
Steve, last week I was in just outside of Destin, Florida, and on the way there and the way back, I was doing 85 on I-10, and they were passing me like I was standing still.
That's right. I got a $280 ticket on Alligator Alley. So they do catch you. I was doing 96.
I was amazed at how fast. I mean, I've been out there. I've done 85, 90, but this time they were literally. I was in the right-hand lane, and they were blowing by me. I don't know how fast they were going.
Oh yeah,
but they were going way fast. So anyway,
I don't know
it's
why
not just
low speed limits. No one adheres to them.
It's different. Once you get to the west side of Tallahassee, that's where everybody changes. On the east side of Tallahassee, they're 75, 80, maybe 85 max. Correct. But on the other side of Tallahassee, it's 90, 95, all the way to Pensacola.
Wow.
Well, there's nothing.
I don't know what it's like in Texas.
It's a different time zone.
Yeah.
Frankly, there's nothing much north
of Orlando. It's a different time zone out there.
Yeah.
We did that drive and all the way to California.
We took I-10 all the way?
All right, Ed, start us off.
Yeah,
it's going to be that kind of a day today. I know. I knew it before we started.
My name is Ed Burton with Seacoast Sales out of Orange Park, Florida. We're an equipment supply company that specializes in frozen dessert equipment. So we have display cases from ISA, IFI, and GTI Design. We have batch freezers, soft serve machines by Carpigiani, and we have BGI ice cream equipment. You can reach me at 904-334-4489. And we have parts for equipment and service repair people and sell new equipment also. Have a great day, everybody.
Thank you. Tracy, good morning.
Morning. My name is Tracy Pumo. I'm with Skyline Analytics here in Boca Raton, Florida. We are a full-service business intelligence consulting firm, and we provide customized solutions that help companies enhance visibility into their financial data. I can be reached at 561-512-1933.
Okay, thank you. Brian, good morning.
Good morning. I'm I'm Brian with Rogue Financial Group. We're a commercial equipment financing company. I primarily focus in the hospitality industry, but we do other industries, focusing on equipment financing. But what I do in the hospitality is restaurants, bars, breweries, and I do a lot of work in the convenience store side. But we also will work with startups and help vendors with their clients looking for financing. Again, it's Brian with Rogue Financial Group, 404-723-7222.
Okay. Steve, good morning.
Good morning. I'm Steve Whitehill. I'm a business broker and I help people buy and sell businesses. Normally, I like to mention one listing that is restaurant related, but today I want to show you the variety of stuff you can get. I have a plant nursery that you can buy for the mere price of $3.1 million. Included in that is a piece of property for $1.5 million. That business makes $662,000 on $2.3 million of revenue. So it's extremely profitable. And with an SBA loan, you could buy it for probably around $320,000. And you can actually, because it's got land involved, finance it for between 20 and 25 years. So there are all sorts of interesting businesses that I have available besides all the wonderful restaurants that we sell as well. Steve Whitehill, Anchor Business Brokers. You can reach me at 561-376-7500. And my email address is steve@anchorbb.com. Thank you.
Okay, thank you. Chris, good morning.
Good morning, everybody. Chris Kaufman. We specialize in placing aces in great places, primarily recruiting in the restaurant industry. And we work on behalf of small, medium-sized companies as well as large companies to basically enhance their human capital, which should translate to more profitability for these companies. And we work throughout the United States. Most of our work is in the Southeast United States, which would be Virginia down to Miami, over to Texas, and back up to Tennessee. We work on behalf of these companies to find the talent that they're looking for that they may not have been able to find themselves. Chris Kaufman, placing all-star talent. And really, a great way to remember our telephone number is if you can remember All-Star, ALLSTAR, then you are smarter than a fifth grader. And therefore, it's 404-255-7827, 404 All-Star. Chris Kaufman, thank you very much. Appreciate you stopping by.
Well, Chris, that eliminates me.
Well, I'm sorry to hear that. We have tutors. We have tutors available.
We did a email blast for Chris this week, and we posted it on social media, and we got several people who commented that they knew you, they loved the work you were doing. I think, and most of them were Brian. But there were. I should have. I'm going to try to put them all together and send it to you.
Thank you.
Terry, good morning.
Good morning, everyone. Terry with today's restaurant news. There's no following Chris Kaufman, and Steve did a terrific presentation, so I'm not even going to try. If you want in Florida and or Georgia, let me know. I'll send you a sample sheet. Now, I did send one to Azalea, and she actually immediately purchased the leads report and is thrilled to have it. So we had 80 brand new leads in Florida last month. We tell you where they're opening, when, owners' names, phone numbers, most importantly, email addresses. Terry@trnusa.com. Thank you.
Okay, thank you. Joe, good morning.
Good morning, everybody. Joe Cregan with Card Payment Services here in Fort Lauderdale. We provide, we support about 750 clients, which about 50% of them at least are restaurants in through our offices here in outside Fort Lauderdale and outside Orlando and Altamont Springs. We are a reseller or an ISO for Fiserv, formerly First Data Payment Systems, credit card processing. We are a reseller for Clover POS and Adelo POS, which is really focused on the hospitality industry. Been doing it for years, supporting small, medium, and large restaurants and hotels. You can reach me at 954-635-5044 or www.cardpaymentservices.net. Thank you.
Okay, thank you. And without further ado, I want to introduce Rick Israel.
That's I take that as a compliment. That's
It's a habit. I don't know.
Understood.
The son of Steve Israel, Rick Israel, who's going to give us his presentation of his company today.
Good morning,
and
everybody.
you can share the screen if you want it.
Okay, let me go ahead and. Good morning, everybody. Most everybody knows who I am. I am a independent insurance broker. We delve into Medicare and the ACA and Marketplace. I think I'm the only one here that has absolutely no restaurant experience, but I've been a member of this group now for about 2.5 years. Several of you are our clients. And today, I want to announce that Sunday is the official first day of the 2024 annual enrollment period, which I'm sure if you are a Medicare age or not Medicare age, you see them on commercials and your telephone constantly rings. So I'm going to go ahead and jump into this. I know we're kind of short on time today, so I'm going to kind of go through kind of quick here. Yeah, let's see.
Like that.
You like that, huh?
Oh,
You know who taught me that? Steve Whitehill taught me that.
All right.
I knew it. I knew it.
No, I'm serious. He was one that said, do it this way. This is the way you do it. This is how you bring these things in. So, but yeah, so Medicare with confidence. The problem with Medicare is a big, huge maze, and it's very, very difficult to understand. And it's very important that you get with an independent broker. Independent brokers are licensed, and we are trained under the federal government to provide this information to you. We have to be certified by every carrier that we represent. So I'm just going to jump into this real quick. If anybody has any questions, go ahead and reach out and let me know what your question is. So today we're going to talk about Medicare basics, the important terminology, enrollment periods, plan types, plan recommendations, and help with Medicare costs. Okay. Okay, so Parts A and B coverage, original Medicare eligibility, original Medicare cost, applying for it and enrolling in original Medicare, and additional Medicare plan options. So the more you know, the easier it is will be to you to choose the plan that's right for you. So what exactly is Medicare? Medicare is a federal health insurance program. Yes, folks, it is socialized medicine. Medicare is run by the federal government. It's also has CMS has a plan, Centers for Medicare and Medicaid Services, and of course, Health and Human Services is also a division of Medicare. So important terms you need to remember is premium, which is the price you pay typically on a monthly basis. Your deductible is the amount you pay prior to plan coverage. Your copay is the set amount you pay at a doctor's visit. And coinsurance is the agreed amount you pay for a doctor's service, typically a percentage of the total bill. So we're going to dive into what exactly is Medicare Part A and Part B. So Part A is hospital insurance. It covers your inpatient hospital stays, skilled nursing facility care, hospice care, home health care. And what's the cost? Usually it's zero. But the catch is you need to work 40 quarter hours or pay 10 years into the system of Social Security. If you do not, you will have to do what they call a buy-in, and that is based on the amount of hours that you have paid. Most of the individuals who have this are usually a spouse who never worked and is not eligible to receive any of their deceased husband's Social Security benefits, which is rare, but it does happen. And of course, your Part B, that's your medical insurance or your doctors. Okay, it helps cover your doctor visits, your outpatient care, your home health care, your durable medical equipment, some preventive services such as certain vaccines and cancer screenings. So I'm going to go ahead and tell you right now that all vaccines will be covered next year. That also includes the shingles. So if you have not received the shingle shot and you are on Medicare, you will get it at no cost next year. The premium is determined by CMS. It was announced yesterday that for 2023, your Part B premium is $164.90. Next year, it's going to be $174.70. So it is going up $9.80 per month. But there is supposed to be a 3.4 to 3.6% COLA. So it may end up being a wash for some individuals. So just be prepared for that. Medicare Part B standard premium income adjusts annually, and it changes slightly each year. And your Part B premium, for those who are not on Medicare yet, your Part B premium is based on your adjusted gross income 2 years prior to your eligibility for Medicare. So if somebody's going in Medicare in 2024, the government will look at your 2022 AGI and determine your Part B premium. And finally, it can be deducted from your Social Security check. If you are not receiving Social Security when you enroll into Medicare, you will get a bill, and they will not forget to send you a bill for a quarterly amount. So when are you eligible for Medicare? Everybody says, oh, when I turn 65, but there's a couple more things there. First of all, age 65 or older, are under age 65 and have certain disabilities. You have to be collecting Social Security disability income. And you collect it for 24 straight months. And your 25th month, you're automatically enrolled into Medicare. You have end-stage renal disease. So upon diagnosis, 4 months after your dialysis treatments, you're eligible for enrollment. And as soon as you are diagnosed, if you are diagnosed with ALS, you are automatically enrolled into Medicare. You have to be a U.S. citizen, and if you are a legal resident from another country, you have to live in the country for at least 5 consecutive years. There are 3 options to enroll in Medicare. One is you can go to your local Social Security office if they're open. Some offices are still closed. They are working remotely. And you can also go to ssa.gov and enroll there. And finally, you can call 1-800-772-1213 or TTY 800-325-0778. Or you can call your independent broker, and they can help you also enroll and help you create a SSA account and help you enroll into Medicare. So you have your initial enrollment period, which is 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. So it's a 7-month window. Okay, so you look here, somebody's turning 65 in April, they can enroll in January and as late as July. Now, most people want it to start in the month of their 65th birthday. So as long as you get the application into SSA by March 1st, you should be able to get an April 1st effective date. Okay. Please remember that if you sign up for Medicare after your birthday month, your effective date and coverage may be delayed. Then you also have your general enrollment period. Now this has changed, so this is not quite up to date. In the past, if you enrolled January through March, it did not start until July. This is not correct anymore. If you enroll after your if you do not enroll till after your 65th birthday 7-month window, you do have to wait until January of the next year, and it will start the next month. So this slide does need to be updated. Just have not had an opportunity to do that yet. Okay. Then you have special enrollment periods. Special enrollment periods give you the opportunity to sign up if you delayed anything. So if you are currently working and you take Part A only and delay Part B, you have 8 months after your employment ends to get your Part B. We suggest you don't wait because obviously you can forget because people do that. Life gets in the way. And when will coverage begin? The first month following enrollment. So if an individual is working and their last day of employment is October 31st, their Part B will start November the 1st. Okay. So there's 3 options that an individual can do. They can take what they call just original Medicare and a prescription drug plan. They can take original Medicare, a prescription drug plan, and a Medicare supplement. And then, of course, they can turn everything over to a managed healthcare system, i.e. Humana, United Healthcare, Aetna, Cigna, Devoted, okay? But please remember, no matter what you do, no matter which option you choose, you must continue to pay your Part B premiums. Okay, the federal government does require you to have minimal drug coverage, okay? Prescription drug plans have specific list of covered drugs or what we call a formulary. Prescription drug plans are sold by private insurance companies. They can and will have monthly premiums. And there is a co-insurance involved. And then there's tiered copays. Most of your prescription drug plans have a 5 up to 6 tier level. And the price of your drug is based on the plan you choose and the tier level the drug falls in. There's 2 ways to obtain it. You can enroll in a standalone prescription drug plan, like we said in the earlier slide, either with a Medicare supplement or just with original Medicare. Or you can enroll in a Medicare Advantage plan, which does include Part D. Now, there's also what we call Medicare supplements. At the time of this script, 14 million Americans were on a Medicare supplement plan. So Medicare supplement plans help cover costs and services not covered by original Medicare, covers out-of-pocket costs and can include copays, deductibles, and coinsurance. And most common plans are G, N, and F. Now, if somebody turns 65 after January 1st, 2020, a Plan F is no longer available. If you are in a Plan F before 2020, you are grandfathered in, and if you want to shop for a new supplement, you are still eligible for a Plan F. They're sold by private insurance companies, so they have their own underwriting departments. Premiums vary by state and plan, and what I mean by that is in Huntsville, Alabama, compared to, say, Miami, Florida, you will see a larger concentration of people. Obviously, insurance is a law of large numbers. So the more individuals in the plan, the more the insurance company would have to pay out. So that means premiums go up. They can require underwriting, and they're often paired with original Medicare and prescription drug plans. And once again, to be in a Medicare supplement, you have to be in both Part A and B. Now, everybody hears about Part C. Part C are Medicare Advantage plans. They are managed healthcare. They are increasing in popularity due to comprehensive care and low-cost options, and we have actually seen a rise in enrollments in Medicare Advantage plans due to the cost of inflation and out-of-pocket expenses for individuals. So Medicare Advantage plans cover both A and B. They most often cover your drugs. Some plans can be as low as 0. They do have annual out-of-pocket maximums, or what we call a stop clause. And they have network of doctors and hospitals. They are sold by private insurance companies, but there's no underwriting. They're typically guaranteed issue, and are not paired Medicare supplements or usually prescription drug plans. What that means is you cannot have a Medicare supplement and an Advantage plan at the same time. And once again, you must be enrolled in both Medicare A and B. So remember, just to recap here, you have your initial enrollment period, which is a 7-month window. Your special enrollment period year-round if you meet certain qualifications. Annual election period starts Sunday, October 15th, and runs through December 7th. And the open enrollment period is January 1st through March 31st. So Medicare plan enrollment, initial enrollment period is your IEP. Once again, 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months following. Medicare supplement insurance is a little different. It opens with your Part B effective date. So even if you delay your Part B and you're 70 years old, you can still enroll in a Medicare supplement because you've had credible coverage. It closes 6 months after you enroll in your Part B. And after this period, underwriting is required. So special enrollment period, why would somebody have a special enrollment period? You moved out of your current coverage area. So let's say that Terry finally convinces Howard to move to Tennessee. That would be a special enrollment period. They move out of the area of Florida and they have new plans. Plans are county, state, and market specific. You qualify for both Medicare and Medicaid benefits. And you recently retired and are coming off a group employer plan. One thing I want to stress is COBRA is not a creditable coverage unless you're on COBRA before you turn 65. It's if you are on COBRA after you are 65. It is not considered credible coverage, and you will most likely hit a late penalty. So once again, the annual election period starts October 15th, runs through December 7th. And that's the time of year that if you're on a prescription drug plan or a Medicare Advantage plan, you can review those plans. A lot of people say, well, what about my Medicare supplement? Medicare supplements can be sold all year round. There is not one specific time unless you're on a Medicare Advantage plan and you want a supplement, you do have to wait until the annual enrollment period. January 1st through March 31st, once again, is the open enrollment period. If you're enrolled in a Medicare Advantage plan, you can either switch to a different MA plan or disenroll from an MA plan and switch back to original Medicare. So after annual enrollment ends, if an individual approaches me after January 1st, I don't like what you put me in, I want to go back to my supplement. You go back to the supplement and a prescription drug plan, guaranteed issue. Now, there is assistance to pay for Medicare. So each state and federal programs that assist with healthcare and prescription drug costs, and most are based on income, assets, and current health condition. So you have extra help, or commonly known as LIS, that is low income subsidy. That is where the federal government kicks in the majority cost of your prescription drugs. And then you have the Medicare Savings Program in the state of Alabama, and I believe Florida is a little bit higher, $1,600 in Alabama. So if an individual by themselves makes less than $1,600 a month, they're eligible for the Medicare Savings Program, and that pays for your Part B premium. And of course, you have Medicaid. You would be fully dual eligible. And you have the PACE, which is a program for all-inclusive care for the elderly. We do not have PACE here in Alabama, but they are in Florida. Okay, so when choosing a plan, consider your budget, consider your doctors, consider your drug cost, your frequency of care, your likes and dislikes, your travel habits, and much more. Licensed insurance agents like myself are authorized to offer assistance and advice. We are trained to assist you in choosing a Medicare plan. We certify every year with every carrier and plan that we represent. And finally, our services are at no cost to you. So we don't charge anything for the review, and we can help you save time and money. And there you go. If anybody has any questions, let me know.
Yeah, Rick,
Yes.
in the early part of the presentation, you talked about Medicare would cover durable equipment.
Durable medical equipment.
Okay. Who makes that call?
If you need durable medical equipment, it's usually if you're on straight Medicare with the supplement, Medicare makes the call and they determine and they authorize it. If you're on a Medicare Advantage plan, the insurance company makes the call. And usually if you've got a really good doctor and knows how to code it, you shouldn't have a problem.
Well, when I came out of the hospital April 15th of this year, they gave me a wearable defibrillator. Okay. And that costs $4,720 a month. I'll tell you. And you're coming out of the hospital and they say, well, this is just an emergency, just in case the heart stops. This wearable defibrillator will restart the heart and you'll be in good shape. That was the purpose of it. I talked with Humana, who I have the supplement stuff with, and they paid more than 80%. They paid like 85% of the $4,720. But I get this bill from this company called Life Vest, hitting me for $600 a month and the way they did the billing is just unbelievable. I came out of the hospital April 15th. That's when they started the bill, April 15th. And then June 15th and July 15th, I quit wearing it. I returned it. They got it back by July 26th, but they still got billed for the entire month.
Mm-hmm.
So anyway, and they did a little bit of a prorated on that. Is there what recourse would I have to object to this being charged to me or to whatever, or any recourse?
You have to file an appeal.
With whom?
With the insurance company.
Okay.
Yeah. Anytime you have health insurance, you always have the right to file an appeal.
Yeah.
Because you've got you've got the appeal which goes against the insurance company. You have a grievance that goes against the doctor. So if you believe that you didn't need the defibrillator, you can file a grievance against the doctor. Why did you prescribe this? Okay. If you're concerned about the bill, then you file an appeal with the insurance company, and that's got to be in writing to them, and then they take care of it from there. And sometimes it can go up and down.
Okay. Thank you.
You're welcome.
Chris, there was a ProPublica article about insurance denials and everything, and they shared a template to request an appeal, and I just put the link for that template in the chat.
Thank you.
Leverage that.
Yeah. And Chris, I'll be honest with you. I try and educate my clients, and that's really what it's about, Chris. It's, a lot of individuals think insurance agents are just there to make a dollar. Well, I'm not going to lie. We have to make a living. Okay. But you've got the scrupulous agents out there who just take the money and run, and you lose all communication with the agent. I try to educate my agent that if you have a question, if you have a concern about a bill, about a doctor, come to your agent and I'll help you figure out what we need to do. Because even though the consultation fee is free, I am being paid by the insurance company, but I still have a relationship with the client, because I don't want the client going someplace else. I want the client to stay in my office and help them and build that relationship and build that trust, because you yourself are running a business. You don't have time to sit on the phone for 3 or 4 hours trying to fight with the insurance company. That's why you hire an independent agent, because that's what I do all day long. I have fought with insurance companies, and I'm fighting with one right now for a client, and we are very, very close to winning. It's just making sure that the T is crossed and the I is dotted. So.
Great.
Rick, you bring up a point. Let's go back to the commercials that were on TV with Joe Namath a couple of years ago. How were they able to say if you, depending on your zip code, they would get more money into your social security check.
Well, first,
How are they doing
well,
that?
first of all, Ed, you're not going to see those commercials anymore.
I know you don't.
As of 2024, what they were doing is that was misleading. That's why every phone call for enrollment I make has to be recorded now. That's why every Zoom call that I enroll with enrollment has to be recorded now. Because the thing is I have certain specific ethics that I have to follow. Those people are not ethical. So now what they're doing is they've gotten rid of all those spokespeople. And what you will see advertised is specific carriers. I saw a commercial yesterday for a company called ehealth.com. Okay. And it's where if an individual just wants to do it by themselves, no problem. It makes it a little bit easier for them, but what they're doing is they're showing the carriers they represent. And that's what they weren't doing. And I get phone call after phone call. Why can't I get my Part B free? Well, you can. Well, how do I do it? Sell everything. Sell everything. Sell all your assets, sell your house, sell everything, show no income coming in or very little income coming in, and then you can get it. Well, I don't want to live that way. Sorry, that's the only way you can get it. It's designed specifically for, and that was misleading. And to use the zip code, it took me a little while to figure out what they were doing, is because every Advantage plan is specific to that zip code. So what they're saying is, give us your zip code and we'll find the plan where you can get that free Part B. They're not telling if you qualify, because they want them to call them on the phone. They want to capture that client. And those are call stations overseas. They're not even in the United States of America. So, hopefully those commercials will be a little bit more understanding and not so bold and brazen.
Yeah.
And I can't, telephone calls and the mail ain't gonna stop though, Ed, sorry.
I got one of those overseas guys the other day for another issue. I said, "What's your name?" Yes, my name is Tex. And your boss's name is Mex, right?
So, but a couple of people on this call are our clients, been in our book of business for a while. But if you do know of anybody that is looking to have a review of their plan, or they have parents or grandparents that need help, I am licensed in Florida, Alabama, Georgia, Tennessee, South Carolina, and Mississippi.
Okay. Any other questions for Rick?
Great job.
Yeah, great job.
Thank you.
Rick.
Yeah, I like the presentation.
Yeah.
Yeah.
Very
wow.
nice.
Yeah, the one that created it left. The one that helped me create it left.
People don't realize how lucky they are to see a presentation like that now if they're looking to sign up, because it can be confusing. And it was confusing to me personally years ago when I had to sign up, and I'm a visual person. I like to see things, and these kind of things weren't available. So it's great and your knowledge of the subject is terrific. So you're a great asset. So I appreciate it and thank you so much.
You're very welcome. Thank you.
And anybody have anything else they want to say? Or okay, well, this brings us to the end of our time today. So thank you all for coming. Stay safe. Have a great weekend, and we'll see you next week.